Bismillahirrahmanirrahim. Assalamu alaikum. My name is Zainab Shafron 119. I am going to present my presentation, and presentation topic is heroin. These are the content of my presentation: introduction, synthesis, pharmacology, metabolism and excretion, effects, abuse, detection, treatment, current research, and then conclusion. Basically, first of all, we discuss about the introduction of heroin, and I am going to present the topic of heroin. So basically, I tell you about what is the effects, treatment, its consequences, and the results. This is metabolism and excretion of heroin. First of all, we discuss what is heroin. Heroin belongs to a group of pain-relieving drug called narcotics. The drug comes from a flower known as opium poppy that grows in Asia, Mexico, and South America. Then there are different types of heroin according to their color. Pure white, pure heroin is has white color, and then there are other type of heroines that include dark brown, white, black, and other tar heroin is sticky or hard and look like a roofing tar. These are the types of heroin according to their color: black heroin, brown, and white. White is also known as pure heroin because of its color. Then it is the chemical structure of heroin. History of heroin. Heroin is an addictive opioid drug, has a long and complex history. In this presentation, I will explore the key milestones and the developments in the use of heroin throughout history. Early origin: opium cultivation in Asian civilization. Opium poppy cultivation trace back to the ancient and Egypt. Opium poppy, that is a flower that cultivate heroin, has been used for thousands of years for its medical and other purposes. Then we discuss the oscillation of morphine. It means how heroin is converted into morphine and then monoacetyl morphine. It's also known as 6-mem. Um, uh, Isolates morphine from opium poppy flower, leading to a significant advancement in pain relief. Morphine gained popularity in 1804 when American Civil War is occupied, and people used morphine as a pain killer, so it's gained popularity due to the powerful painkiller and used worldwide in American Civil War. Then we discussed 1874. In 1874, morphine is synthesized into diacetyl morphine 6-mem, later named as heroin. Heroin was initially marketed as a non-addictive substance. Then people use it for as a drug, and then it become as addictive substance. Rise in heroin use. After 19th century, the mid of 19th and the 10th century become worse because of the people use it as a drug, and heroin was initially promoted as a wonder drug. But later, the addictive nature of heroin became evident, leading to the restrictive regulations and medical warnings. International Opium Convention in 1912 treaty attempt to regulate the production and distribution of opium poppy flower, morphine, and heroin. And then heroin in 1924, the United States banned heroin production, sales, and possession because people used it as a drug and become addictive of it. Then we discussed the 20th century. Underground and black market is produced heroin and started its sale, production, and cultivation expanded globally. The drug become countercultural movements and affect communities. Public health concerns is about to ban the production and cultivation of heroin. Then heroin is also responsible for the spread of HIV and AIDS. diseases that are very risky for the people. So heroin use contributed to the spread of HIV/AIDS in the 1980s. Overdose of heroin also caused death. Heroin overdose increase promoting public health issues and harm reduction strategies. Contemporary heroin use. Heroin remain as a significant public concern worldwide, and phenyl and other synthetic opioid had contributed to the recent surge in the overdose death. Then conclusion of the history is that the heroin use in intertwined with global trade of opium, poppy, the discovery of morphine, and the subsequent substances and introduction of heroin. Understanding this history helps shed light on the challenges we face today in combating heroin addiction and its associated consequences. Then we discuss how heroin works in our the body. Usually people use the different methods for the inhalation of heroin. Some people used their nostrils for the intake of or inhalation of heroin. Mm, but other people used injections uh, to take heroin into their bodies. First of all, we discuss basically how does heroin works in body. You take heroin. Heroin enters the bloodstream in seconds. Then the heart pumps the blood throughout the body, carrying the drug with it. In the brain, heroin undergoes several chemical reactions and changes back into morphine. Then it binds rapidly to the opioid receptors to cause euphoria, anxiety, and pain relief. Heroin undergoes extensive first pass metabolism in the liver before entering the body circulation. Heroin has an extremely rapid half-life, and it takes 2 to 6 minutes to circulate all over the body through our blood. There are two types of effects of heroin. First one is short-term effects, and then long-term effects. Short-term effects are shown in those people that use it once or two or 3 to 4 times in a month, and long-term effects are shown in those people that use it regularly regularly based. And short-term effects include dry mouth, warm flushing of the skin, heavy feeling in the arm and legs, nausea and vomiting, serve itching, clouded mental functioning, go on nod, and feeling a rush. In this slide, I will explain the body parts of a human body and the effects of heroin. This is the central nervous system of the human body, and the effects of heroin are euphoria, alternately alert and drowsy state, and mouth become dry, skin become warm, flushing, respiratory system that are responsible for breathing become slow, and muscular system and the muscles that are responsible for our relaxation and flexation become weak. Effect of heroin. The second effect of heroin is that long-term effects, and it include collapse, pain for people who inject the drugs, damage tissue inside the nose, people that sniff or snort it, and infection of heart lining and veins, stomach become comping, liver kidney disease, lung complications occur in those people that use it regularly basis. Diseases like pneumonia and AIDS and HIV are shown in them. Central nervous system addiction, tolerance, dependence, and respiratory system, pneumonia, heart infections, circulatory system that contain veins become collapsed, liver function decrease, and systematic abscesses. Then we discussed the metabolism and excretion of heroin. It basically tells about how heroins work in our body and when it excretes from our body. Heroin undergoes rapid metabolism in the body, primarily through as a enzymatic process in the liver. The metabolism of heroin result in the formation of several metabolites including morphine and 6-monoacetyl morphine, also known as 6-MAM. These metabolites contribute to the pharmacological effects of heroin. Metabolism of heroin involve the following steps. First one is conversion to morphine, and second one is formation of 6-monoacetyl morphine. It's also known as 6-MAM. And the last and the least, further metabolisms. First one, conversion to morphine. Once heroin enters the blood, it is rapidly converted into morphine. Morphine is responsible for the analgesic and other associated functions with the central nervous system. And formation of 6-monoacetyl morphine. Alongside the conversion to morphine, heroin is also metabolized into 6-MAM. 6-MAM is a unique metabolite of heroin and serves as a marker for recent heroin use. It has a shorter half-life compared to the morphine. Further metabolism, both morphine and 6-MAM can undergo additional metabolic transformations. They may be further metabolized into other glucuronide conjugates and other minor metabolites that are responsible for the functioning of heroin, and that affects our body. These metabolites are less pharmacological active than morphine and itself. This slide shows the comparison of heroin, morphine, and 6-MAM. Heroin is basically converted into two type of metabolites. First one is morphine, and then 6-MAM. Enzyme involved in the metabolism. Enzyme are proteins that catalyze any chemical reaction. Enzyme involved in the metabolism. The metabolism of heroin is mainly mediated by specific liver enzymes, partially cytochrome P450 and CYP enzymes. And there are two types of CYP enzymes that are CYP2D6 and CYP3A4. CYP2D6 is responsible for the conversion of heroin to morphine, and the other one is CYP3A4 is responsible for the formation of 6-monoacetyl morphine. Elimination from the body. In this slide we discuss about how heroin is excreted or eliminated from our body. So basically the metabolites of heroin are eliminated from the body through various routes, mainly urine and feces, the morphine take 2 to 3 hours to eliminate from our body, and the 6-MAM have a shorter life approximately 10 to 20 or 20 to 30 minutes to excrete or eliminate from our body. It is important to note that the metabolism and excretion of heroin can vary among individuals based on their genetic variations, liver functions, and other individual specific factors. Abuse of heroin, pattern and trends of heroin. Heroin abuse has been a long-standing issue, but patterns and trends can change over time. Heroin use may vary across different regions and population due to the factors such as availability, cultural influences, and socio-economic conditions. It is essential to analyze current data and research to understand the most recent pattern and trends. This graph shows the comparison of different years, which either if we compare 2002 to 2013, so in 2002 the intake of heroin is very low, but in 2013 the intake of heroin is more served as compared to 2002. Past year heroin abuse or dependence, heroin related overdose, death, and rate of past year heroin abuse of dependent 100,000 per person. So basically as increasing the year, the intake and cultivation, smuggling of heroin is also increases. Demographics of users. Heroin abuse can affect individuals of various ages, gender, and socio-economic background. Heroin abuse was more prevalent among certain demographic groups such as urban populations and lower income individuals. However, recent trend has shown an increase in heroin abuse across different demographic, including suburban and rural areas. Factor contributing to heroin use vary among different demographic groups, including factors like peer influence, trauma, mental health issues, and other substances abuse. Routes of administration. Heroin can be used through different routes of administration, including injection, snorting, and smoking. So basically, injection, snorting, and smoking, we discussed one by one these. Injection has traditionally become a common route due to its rapid onset of effects. It poses additional risks such as the potential for injections, collapsed vein, and transmission of a blood-borne disease. Pictures show the injections. Routes of administration. The second point is snorting, involve inhaling powdered heroin through the nose, leading to the slower onset effects but still carries risks of adverse effects and addiction. Smoking heroin involves heating the substance and inhaling the vapors. This method is less common than injection or snorting but is still practiced by some individuals. This is a picture of snorting of heroin, and this is a picture of smoking of heroin. Prevalence of abuse. The prevalence of heroin abuse can vary based on geographical location and time frame. Monitoring surveys and studies such as the National Drug Survey can provide insight into the prevalence and trend of heroin abuse. It is important to consult up-to-date data sources and research studies to gather accurate and current information on the prevalence of heroin abuse. Then we discuss detection of heroin use. How can we detect heroin use? We can do different tests in laboratories to detect heroin. Basically, there are different tests, including urine test and blood test. Urine samples can be analyzed to detect the presence of heroin and its metabolites. It is the one of the most common method for drug testing due to the relatively long detection window, and blood testing is also used for the detection of heroin. Blood samples can be analyzed for the presence of heroin and its metabolites. Blood testing is useful for detecting recent drug use and can provide more accurate result compared to the urine test. Behavior approaches, its mean how can we treat different patients of heroin addiction. Some common behavior approaches include CBT, CM, and MI. Cognitive behavior therapy. CBT helps individuals identify and change negative thought patterns and behavior associated with the drug use. And the second one is CM, contingency management, utilized positive reinforcement to encourage drug-free behavior. And the third one is motivational interviewing, in which people motivate addictive people to come back their regular life and to say no to drugs. MI aims to enhance motivation and commitment to change. These are the pictures of treatments of heroin. The first one is of CBT. Second one is the contingency management, and the third one is the motivational interviewing. These pictures showing how can the different treatments or processes to stop the people from the heroin addiction. Pharmacological approaches. Some common pharmacological interventions include methadone, and methadone is a long-acting opioid against that can reduce the craving and withdrawal symptoms. It is administered orally and requires close monitoring and supervision. Then the second one is buprenorphine, and buprenorphine is a partial opioid engaged that can relieve withdrawal symptoms and reduce cravings. It has a low risk of abuse and overdose compared to the heroin or methadone. And the third one is the naltrexone, and naltrexone is an opioid antagonist that blocks the effect of opioid. It can administered orally or through a monthly injection to prevent relapse. This picture shows the comparison of two types of pharmacological approaches. First one is the methadone. It shows the full against tightly attaches to opioid receptors, and second one showing partial against activates opioid receptors to a lesser extent, and third one showing antagonists block the effect of opioids. And new treatments and new approaches of to stop heroins are that people take different type of vaccines and medications. Mm, Vaccines researchers are investigating the development of vaccine that target heroin and its metabolites, aiming to reduce the rewarding effect and prevent relapse. And then medications efforts are underway to identify and develop non-opioid medications that can effectively manage withdrawal symptoms, reduce craving, and support long-term recovery. These pictures are shown in this picture showing a person that are addictive of heroin. Then vaccine are injected to the dead person engaged heroin, and the third picture showing heroin used after vaccination. In this picture, the patient using heroin, and the same person is undergoes vaccination process, and this picture showing heroin use after vaccination. I mean, it's picture showing the changing of changes in the human body after the vaccination process. Effects to the CRUB abuse. Various interventions aim to prevent heroin abuse and reduce its societal impacts. And some ongoing efforts include to curb abuse or harm reduction strategies. These strategies focus on minimizing the negative consequences of heroin use, such as needle exchange programs, overdose prevention, education, and distribution of naloxone. And the second one is public awareness campaign. Different type of campaigns aim to raise awareness about the risk of heroin use, reduce stigma associated with the addiction, and encourage people seeking behavior. And the third one is policy and law enforcement. Effects to combat heroin abuse involve stricter regulations, enforcement actions targeting drug trafficking, and initiatives to uh, disrupt the drug supply chain. In the last, we discussed about the conclusion of the topic that assigned to me is heroin. So basically, the conclusion is that the study of heroin has provided insight into its chemical structure, synthesis, pharmacology, adverse effects, patterns of abuse, reduction methods, treatment options, and current research. Heroin, with its potent effects on central nervous system, bind to the opioid receptor, leading to a range of physiological and effects. However, its use comes with significant risks, including addiction, overdose, and long-term harm to the body. Overall, the comprehensive understanding of heroin, from its chemical properties to its societal impacts, provide a foundation for addressing the complex challenges associated with its use. Continued research, prevention efforts, and comprehensive treatment approaches are mitigating the harmful effects of heroin and supporting individuals affected by its abuse. In the end, I am going to say that people should avoid heroin and as a nation, it's our responsibility to encourage the addictive peoples to come their regular life and stop taking different types of heroines. Basically, the message is that no heroin, and say no to drugs. That's all from my side.